Good afternoon. I'm Ariel Reshef here with the latest on President Trump and his battle with COVID-19.
And some breaking news. After teasing it on Twitter, President Trump briefly left Walter Reed Hospital in a motorcade to greet supporters waiting outside. The president was wearing a mask, and you can see him waving at those supporters through the window. We should note the president remains hospitalized and will not return to the White House tonight.
As the president remains hospitalized, a White House official telling ABC News that Vice President Mike Pence and Second Lady Karen Pence have both tested negative for COVID-19 again today. That's the third day they've tested negative since President Trump's diagnosis. This comes after the president's doctors at Walter Reed told reporters that President Trump is getting better, but did receive supplemental oxygen on Friday.
Thursday night into Friday morning when I left the bedside, the president was doing well, with only mild symptoms, and his oxygen was in the high 90s. Late Friday morning when I returned to the bedside, the president had a high fever, and his oxygen saturation was transiently dipping below 94%. Given these two developments, I was concerned for possible rapid progression of the illness. I recommended the president we try some supplemental oxygen, see how he'd respond. He was fairly adamant that he didn't need it. He was not short of breath. He was tired, had the fever, and that was about it. And after about a minute, on only 2 liters, his saturation levels were back over 95%. Stayed on that for about an hour, maybe, and it was off and gone.
That admission that the president did receive oxygen is a complete reversal from what his doctor said just yesterday. Here was his explanation.
I was trying to reflect the upbeat attitude that the team, the president, that his course of illness has had. I didn't want to give any information that might steer the course of illness in another direction.
Joining me with more on the phone is White House reporter Rachel Scott. Rachel, you've been on the ground there at Walter Reed. A rather striking reason that the doctor is giving there. What's the latest on the president's condition that you're hearing? And we're also now learning why there may have been some mixed messages coming from the president's doctors and his own chief of staff, and it might have had to do with a fever.
Yeah, that's exactly right, Ariel. And I just want to get right to the news here because just moments ago, President Trump tweeted saying he really appreciates the fans and supporters outside of the hospital. The fact is they really love our country and are seeing how we are making it greater than ever before. President Trump sending that message from inside Walter Reed Medical Center where he is right now. You know, his medical team said that he could be released as early as tomorrow. But you're right, there have been mixed messages from physicians and the administration, which is raising questions about the true nature of the president's conditions. You heard the president's physician there saying that he did administer oxygen to the president at the White House on Friday, but just 24 hours earlier, he said that he did not. Sources told us that the president did receive oxygen on Friday at the White House, that he was having trouble breathing. But all of this is raising some questions about why the White House medical team was not honest with the American people from the beginning. They are trying to paint this rosy picture about the president and moving forward with moving past the virus, but it does contradict statements that we've heard from his own chief of staff, who said that the next 48 hours would be critical in terms of his care, and that the president's symptoms over the first 24 hours were very concerning. So that led to a question being asked today to the president's medical team of whose statement should the American people believe, the president's physician or the White House chief of staff. We are learning that the president was irritated with Mark Meadows for saying that. He sought to reassure the American people a little bit later, posting a video on Twitter saying that he was feeling better and he hopes to be back at the White House soon. And we'll just have to see whether or not the president is discharged tomorrow.
Yeah, and Rachel, we're also hearing just now that Vice President Joe Biden is willing to move forward with debates. But any word on the ground about how this would even happen given the president's condition?
You know, this is something that we truly have never seen before, and a lot of this is going to depend on how the president is feeling over the next 2 weeks. I mean, we are just 2 weeks out from that next presidential debate. Vice President Joe Biden, even on the campaign trail this past weekend, said that he would like to debate the president again, and that would be twofold. One, that means that the president is well enough to be back on the stage, but secondly, he could make his case to the American people. But look, we just have 1 month to go, and right now, the president president is in the hospital suffering from a virus that has killed 200,000 people. He's said to be improving, but also there's this growing list of advisors and aides close to the president, both in the White House and on the campaign trail, that have tested positive. The two heads in charge of leading his re-election efforts, the chairwoman of the RNC and the president's campaign manager, have both tested positive for the virus. So this is a major shakeup to the campaign, but I'm sure both of these candidates would like to be back on that stage making their pitch to the American people. But right now, it just may be too early to say.
Yeah, it's so many questions surrounding how they would even be able to do so safely at this point. Rachel, stand by. I also want to bring in Dr. Todd Ellerin. Dr. Ellerin, what's your biggest takeaway based on what you've been hearing from the president's physician, especially that about face that we saw today?
Right. So I think, this underscores the importance of accurate medical information, Ariel. I mean, we need to know that, if we're going to have daily press conferences, we want to know that what we're hearing is accurate, in fact. I mean, let's face it, COVID-19 is challenging enough, given its uncertainty, given the fact that you can be well 1 minute and then the next day you can be fighting for your life. I think it's good news right now that the president is off oxygen. Hearing that he was on oxygen transiently makes me think this is more than just a mild case. Perhaps it's a moderate case. Now, remember, most patients with COVID-19, even those that are hospitalized, do walk out of the hospital on their feet. So I'm feeling, encouraging overall for the president, but there is uncertainty with this. The beginning phase, which is virologic, as the virus rises, that can then turn into an inflammatory phase. So we want to make sure he doesn't have an inflammatory storm. Dexamethasone, that steroid, can help quiet that. But overall, we have to take this day by day and just make sure that he's getting meticulous around the clock care.
And Dr. Ellerin, so many of the people who tested positive were at the Rose Garden celebration for Supreme Court nominee Amy Coney Barrett at the White House. We saw those images. You see them right there. Maskless people sitting, not social distance. We've been talking about super spreader events and the nature of these. Does this event now, in your mind, as an infectious disease specialist, should it be categorized as one of those super spreader events?
It's such an important point. COVID-19 is not like other infections, like influenza, which tends to infect a predictable number of people. With COVID-19, it's unpredictable. A recent study from India showed that 70% of people who are infected don't transmit the virus to anyone, and 8% of patients who are infected lead to 60% of the transmissions. I am very concerned that the Rose Garden event was a super spreading event. It's not only about that person or people that may have high amounts of viral load and emitting those, but it's also about behaviors. Not wearing masks is not okay. Having no physical distancing in between, that's not okay. The U.S. right now constitutes 20% of global cases and 20% of global deaths. Our pandemic playbook right now is not operating optimally. We need to do better, and that starts with changing behavior. My hope is that the president recovers, but with this can sort of champion a culture of safety and come out wearing a mask, not saying to the people that it's okay to wear a mask, but that it's very important. He wants to protect himself, his family, and hopefully the American people.
And before you go, Dr. Ellerin, you're an infectious disease specialist. I'm curious to know your opinion on this. The vice president, thank goodness, has tested negative for COVID-19, the third day in a row since the president's diagnosis. But how frequently should the vice president be getting tested in order to ensure that he has not indeed been affected with this disease?
Right. So I think that's very good news that he's tested negative. And remember, like I said, most people, even those in close contact, don't end up acquiring this virus. That's what's so unusual. Yet you can have clusters of people, and it's unpredictable who's going to be infected and who's not. That it underscores the importance of regular testing. I think that's the key. I'm not going to say that he needs it every day or every other day, but it's important to repeat negative tests if you've been in close contact.
Dr. Ellerin, thank you so much, and also thanks to our Rachel Scott. That does it for us right now. Keep it with ABC News Live all day for the latest on President Trump's condition, and make sure to tune in for a full update on World News Tonight at 6:30 p.m. You're watching ABC News Live. I'm Ariel Reshef. Thanks so much for watching.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.